We have Dr. Arif with us, and Dr. Arif is the founder director of Neuropedia. And today we will talk about the special child. Unfortunately, it's not the matter of some specialty, and what are the reasons, how to identify the problems, and what is the broader category of this problem. So we can say, Doctor, we, when a child is growing, so the first, how you will identify there's some problem in the child. It's like for parents as a layman, how they will know there's some issues are there.
Uh, Shani, it's a very wide question. So, physical disabilities or physical problems are seen very easily. If you have a child who's limping, you would straight away take your child to a doctor.
Right.
But emotional, academic, cognitive, intellectual, speech difficulties are hidden. So many parents, they wait for a very long time before they seek medical advice. Conditions like autism, for example. Ideally, the symptoms start by the child is 1 year, 1.5 year, but by the time the parents bring this child in, they are 4, 5 years of age. And this is not generalizing. Some parents do identify it and they bring it on time, but they're delayed. Even worse for conditions like ADHD, which is a very subtle neurodevelopmental condition when your brain works very fast. And parents just ignore it. And by the time the child comes to us, it's like child is 8, 10 years of age, he would have gone through that critical period of education. Things like dyslexia, and there are many movies made on dyslexia.
Yes.
That's one of the things that is not picked up even at schools. Now we have the tools, we have the professionals, and we have an infrastructure where this can be identified and treated early.
Yeah, the dyslexia, we came to know about this problem in journal after this Tare Zameen Par movie.
Yeah.
Before that, frankly, like it was a writing issue with the child.
Yeah.
So what are the broader difference on all these ADHD, dyslexia, and any other issues?
They're like chalk and cheese. They're different. When you said about movies, there was a movie called Rain Man in the 80s, if you remember. And that kind of brought in autism to people's mind, what autism is. Prior to that, 88, 85, late 80s, nobody knew what autism is. And as the awareness began, even doctors started learning more about it, and more individuals were identified and helped early. So let me just compare ADHD and autism. Now, people think they are similar, they can be confused, but it shouldn't be the case. ADHD is completely a different condition where you just have a child who has a mind that is, or the brain that is working very fast. It's like we tell kids that your brain is like a Ferrari as opposed to being like a Toyota, for example. They are very fast, they are distracted very easily, their focus fleets from one point to another, and that affects their learning. But if you can get that attention back, either using the right behavioral therapies or using the right medication, you can get that child in line. I have many friends who are in their 40s and late 40s and early 50s who've never been diagnosed with ADHD. And now they still suffer from it. And I know a number of people who've been diagnosed with ADHD in adulthood. It was missed in the childhood. Autism, on the other hand, is a neurodevelopmental condition where most of the kids do not have much speech. They have significant communication problems and a lot of social issues. And many kids are not independent. They need help even as an adult. So these are two different conditions, and they shouldn't be confused.
Okay, all these problems are through neurology or genetic, or it can be grow like out of the way. Like parents are healthy, grandparents are healthy, and suddenly we'll see the child is coming with the issue.
Most of the families are like that. So it's always the first time that the family has had a child with autism, for example.
Yeah,
it is not necessary
first case in the family,
Exactly.
in the knowledge.
Yes, it's not necessary that every child should have a father or a grandparent who had the condition. But yes, there is familial tendency. It runs in the family more often. Something like you can say diabetes. If my father and mother has diabetes, yes, I have a slightly higher risk of having diabetes, but it's not necessary that I should have diabetes. Autism is slightly more complex. ADHD, on the other hand, also has a familial tendency. But we don't go behind looking for, does anybody in your family have it? Because it's a very clear diagnosis based on the clinical symptoms the child presents with. And there's a standard given by various authorities in the world for us to follow. And that's what we do.
Okay, so again, suppose parents are aware, they know the symptoms, they identify the child. What you will advise? First, you start at home. There are so many apps available. I have seen, and one of my friends is also working in that area. So, what you would advise? Go through that things first, or directly consult with the doctor.
Come to the doctor, or if you have a child with either problems with cognitive ability or social skills or either go to a neurologist or a child psychiatrist or a psychologist, at least to begin with, because the problem will be identified, and then you need a team to work with that child. For example, a child with autism, a neurologist we may be able to diagnose, but I might not be the only person treating the child. There will be a speech therapist, a behavioral therapist, an occupational therapist, and a team around the child and support at school as well.
Right.
But the starting point is the key, because that is the roadblock. Most parents don't bring the child to either of these professionals where it can be identified and treated early.
Yeah, so here the issue, the social stigma is one issue. Like you have seen this, parents are not ready to accept it, or somehow they are trying to hide it.
Yeah.
So there are some. What is the solution for that? Like, are you people doing some counseling with the parents also, who have child, or they don't have even?
Yeah.
They should know about it.
Things are getting better, Shanir. I mean, say, I know 15 years ago, it is a much bigger problem. They never used to go to a doctor to assess what's going on. But now things are changing, especially at least in UAE, I've seen that parents are more upfront, they're bringing their child early, some slightly delayed, but they do bring eventually. Because there are many pickup points. So if the problem at home, parents are more aware of it and they bring. School identifies things much easier now.
Yes.
They send the child to a doctor or a psychologist. Or as the child grows up, their friends might pick up that child has issues, then they will tell their teacher and the teacher. So there are ways now by which these kids come to us as such. Say 15, 20 years ago, this was not the case. And that's why the numbers have increased. The number of cases of ADHD and autism we are diagnosing now is increased because we are more aware and we're diagnosing them earlier.
So you are saying that the number is increasing not because the problem is increasing, because the awareness is increasing.
Yes, 80% of that effect is because of the awareness. Now, you ask me how we in Neuropedia or me as an individual, as a neurologist, we do awareness. So we do a lot of social media activities. I do videos on social media. I have an Instagram post account called dr.arif.khan where I put all these videos out there to parents. When parents come in here, we have sessions for parents where we bring them in, we give them a workshop-like scenario. And of course, schools, which is the main area we have to bring the awareness in.
So the parents who already missed the initial stage, so by what age they can pick it?
It's variable. Now, if you talk about ADHD, it's not usually diagnosed before 4 years. So if someone tells me that, okay, this child is 2 years of age, he has ADHD symptoms, can you diagnose? No. Before 4 years, we don't give an ADHD diagnosis to a child. But after 4 years, there are some kids, like girls especially, who have ADHD. They're very subtle symptoms. And unless you pick them up and take her to a doctor, the child will not be diagnosed at all. In boys, they're very hyperactive, they have inattention. It's much more obvious. And they are classified as kids who don't pay attention and very notorious at school. So they get sent to for assessments. Autism is a complete different ballgame. Autism symptoms are like the child will not talk initially. Right. They have speech deficit. They will not maintain eye contact. You call my name, I won't look at you. That is autism. The child doesn't point. The child will hold your hand and take you there. He will never point to an object. The child will not socialize with other kids. These are much stronger signs and symptoms that cannot be missed.
Right. That you can notice even the initial time, when around 2 or 3 years old. When suppose I will take example like the kid who is the problem with ADHD or any other type of disorder, and he is something like 10 plus, or he's going to like touching the adolescent age. So is there any point where he can come back, or he has to go through this whole?
Most of these conditions, Shani, you can't cure them. So even me as a neurologist, I don't give medications to cure this condition like ADHD. With ADHD, we use medicine sometimes to help the child focus better. So once the child starts focusing better for 2 years, 3 years, 4 years, the brain gets trained to know what focus is, because the child would have never known what focus is. So once you start training the brain, in those 3, 4 years, the child might reach a point where the medications can be taken off, and then he or she herself might be able to focus better. So even if you pick them up late, like 10 years, 12 years, even adult, they take medication sometimes to help them kind of manage their life, even though they have ADHD.
Great. And I have noticed like all the special child, somehow they are very fine in one particular skill.
Yeah.
So what is the reason behind that? Like
a lot of kids with autism, not so much ADHD, but autism and dyslexia even. These are called savant skills. Savant, SAVANT. Savant skills. I know a number of kids, for example, a child who has autism who can't speak, for example, but he can see, an underground tube map of London, and
Oh.
then he will draw it for you. He'll just look at it for, say, 10 minutes, he will draw it for you. So the memory is so sharp, the photographic memory is superhuman. And that skill is fantastic. And of course, we could harness that to get the full potential for the child. There are kids, for example, if I ask you to say alphabets backwards, can you say it?
Definitely not.
Of course not.
Yeah.
Nobody can do it.
Time, and
unless you see,
so many
read
maths
it.
will be there. Huh?
Yeah, you won't never think of it. You can recite it forward very easily.
Right.
But if I ask you to recite it backwards, you can't. There are kids who play with numbers, who play with alphabets, and they're so good in a particular skill that you'd be surprised what they do. But not everybody, not every autistic child should have a savant skill, but many of them do. Yeah.
So again, there is one issue is coming, like the whole this workshops and treatment and all these things. Somehow finance is a big issue.
Yeah.
We have noticed it's
Yeah.
coming. So what your organization or something you people are thinking
Yeah.
in
So
that line?
because, for example, if I take autism as a condition, for a child to receive treatment, you need a number of professionals, and you
Right.
need a school that caters to the children with autism, and the entire cost builds up.
Right.
So, and the cost builds up because your cost of providing those services in Dubai or UAE is high.
Right.
So we as Neuropedia, as an organization, we try to bring that price as low as possible for parents to be able to get their kids on. We provide them packages, we provide them special discounts for consistent follow-up. Like if they do a 3-month training with us or 6 months, we bring the price as low as we can. There are many government facilities that kind of tap into charities to help many kids as well. But there's not enough. We still have to do a lot to make sure that every child in UAE, whether it's expatriates or local, gets the best possible intervention.
So as per Dr. Arif, there is no late at any stage of time. The moment you will identify the problem, you can come back to normal life. And definitely doctors like Neuropedia hospitals, they are ready to help us, and wish you all the best to you and your kids.